Good afternoon, everyone. Thank you for your patience. I think we're going to get started now. And I just wanted to introduce myself. My name is Melissa McVie, and I'm the Education and Home Support Facilitator with the Ontario Association of Residents Councils. And I'm so pleased to welcome you to today's live webinar entitled Finding Respectful, Compassionate Approaches to Persons Living with Dementia, Gentle Persuasive Approaches in Dementia Care. Before we get started, I just wanted to let you know that today's webinar will be recorded so that it can be archived and shared as an online resource on the OARC website. The presentation slides from the session, including the link for the embedded video, are also available in the materials section of the meeting platform. And lastly, to minimize distractions and sound on the line today, all of your lines have been muted. And as I mentioned earlier, there will be an opportunity at the end of the presentation to ask questions, or you can choose to either type them in the chat box or unmute yourself to speak at that time. Now, without further ado, our two presenters today are from the Advanced Gerontological Education, and I would like to introduce them to you now. So a warm welcome to Patricia Boucher, Executive Director, and Michelle Bliss, Clinical Education Specialist. Thank you both so much for leading us through our session today. So I'll hand it over to you, Michelle and Patty.
Thank you very much, and thank you very much to the OARC for inviting us to speak to you today. My name is Patricia Boucher, I'm the Executive Director of Advanced Gerontological Education, and I'm going to be speaking to you at the beginning of this webinar, just informing you a little bit about AGE, who we are, what we do, and our mission of really making a difference in the life of older adults. So on to slide 2, you can see there that we are, our mission is to enhance the care of older adults by learning together. We are governed by for a volunteer board of directors. There's 11 volunteer board members. We're a competency-based board, meaning that the governance committee assesses what the needs are in terms of the various competencies to run effectively and efficiently as a not-for-profit board of directors. We're a not-for-profit social enterprise, and that term may be a little bit new to you. I'm going to define a social enterprise to you in the next couple of slides. We pride ourselves in working collaboratively with our stakeholders. The stakeholders of our master coaches, our certified coaches, are experts in dementia care that really helps to inform our products and to keep our products relevant and updated. We do have a national GPA advisory committee comprised of members across Canada, as well as a research and development committee. We pride ourselves in evaluating all of our products and services prior to being fully implemented. And we are known as a provider of high quality, cost-effective education. We're currently under our 3-year strategic plan, 2016 to 2018, and on the horizon is plans for the new 2019 to 21 strategic plan. But our vision, AGE is a leading innovator in educational services to support the care of older adults in the dementia context. And there you can see what our values are. And I think the most important part of our strategic plan and our governing principles is that we're really focused on making sure that our care providers are equipped with safe work techniques in working with persons with dementia, which ultimately has an outcome of quality resident care. AGE is a national not-for-profit social enterprise. This is a relatively new term, social enterprise, or a new business model that was really introduced in Canada in 2010-2011. A social enterprise is a term used to describe a common practice in the not-for-profit sector or for-profit sector using a profit framework to generate revenues to achieve the organization's mission and not-for-profit objectives. We are not funded by a hospital. We are not funded in any way, not by the ministry. So we really need base revenues to run our operations. But what makes us a social enterprise is that any surplus revenues that we have at the end of our fiscal year is reinvested into new products and service for us to really fully achieve our mission. So we're always looking to maximize revenues, making sure that our product is affordable and accessible, but we are always building on new products. So for example, we are currently developing a bathing curricula because we know that personal care and bathing elicits the most frequent responsive behaviors. So that's just one example. We also assist organizations in evaluating the implementation of GPA. So we really do have a unique business model. So in reinvesting annually, we increase operational capacity within age to keep pace with growth and demand. We are across Canada, and we've had to increase our staff over the last 4 years to keep up with the constantly increasing demand for GPA. We are in every province except Quebec now, and including the Yukon, and most recently, none of it. We are evidence-based curricula, which means we have a responsibility to ensure that our curricula is maintained on a 4 to 5 year curricula cycle. We're committed to developing new curricula, as I mentioned, with the bathing. And for the delivery of our GPA, we want to ensure that we have quality assurance processes by supporting our certified coaches with a growing number of tools and quality assurance measures. We are enhancing knowledge transfer and support as well to our certified coaches, which really does increase their competency and contributes to a quality delivered Gentle Persuasive Approaches curricula. In meeting our responsibilities as a social enterprise, we have done, I think, a pretty good job of promoting ourselves as a social enterprise on the web, and I invite you to check us out on our website. We pride ourselves in ensuring affordable and accessible dementia care training. We have not increased prices for our workshops in 4 years, even though we're meeting increased costs for our training venues and catering costs. The board of directors have been committed to developing a number of refined financial governing policies to meet the definition of social enterprise, and we're enhancing organizational capacity and growing the stable of products and services. We're also really, as we don't see ourselves truly as lobbyists, we really do want to influence policy and policy focused on dementia strategy. So we have released a policy brief to the Ontario Ministry of Health and Long-Term Care, and actually had convened a meeting with the Dementia Strategy Group in February of 2018. We also submitted a policy brief to the Ontario Minister of Labour, new Chief Prevention Officer Ron Kaluski. Staff safety is an important part of our contributing quality to administering the GPA, as the GPA equips our care providers with the skill, knowledge, and confidence to deal with some of the challenging behaviors associated with dementia. We have built relationships that really position us strategically in the market. We have established a recognition program for organizations who have been committed to implementing and integrating GPA into their organizations. So there's a number of valuable testimonials and stories on our web, and I invite you to have a look at our website and read some of those. They're quite inspiring. As I mentioned, we're committed to ongoing coach support. We have certified coaches that actually deliver our curricula. We have invested in developing a quarterly newsletter, both for timely news, but also educational tips on increasing their competency in delivering our GPA. we've developed a tool called the Individualized Behavior Escalation Prevention Plan tool. So this really helps to integrate the gentle persuasive approaches into care planning, which is integral for the sustainability. And we also have a GPA certified coach information package to encourage more certified coaches to become part of the GPA family. This is just a picture of our map across Canada to show you our 11 national members on our advisory committee. While the concentration, is higher in Ontario, we are starting to look at, we've got 3 in BC, 1 in Saskatchewan. We're moving to invite other provinces such as Alberta and New Brunswick, and we'll continue to get cross-Canada representation. And this is just a listing of our current GPA National Advisory Committee membership. I'm not going to read the names, but just provides to you very qualified people and certainly do contribute to advancing our GPA coaching and products and services.
Okay, so now it's Michelle, and I'm going to take over from here to speak a bit more about the GPA content and the learnings that participants come away with to help them in their daily practice. So organizations can implement GPA in multiple ways. The traditional model involves a full-day team-based session facilitated by in-house GPA certified coach, and as Patty mentioned, we are across Canada, and close to 3,000 coaches have been certified since 2004, and we currently sit around 2,000 active coaches that serve in-house as the point-of-care champions for the staff in their organizations. The curriculum was developed and reviewed with adult learning principles in mind, so GPA uses multiple strategies to engage learners who, at the end of the day, can leave with practical skills that can be immediately used at the point of care. The GPA e-learning program has also been developed, reviewed, revised, and evaluated, and it consists of online modules that allows learners to receive the key GPA content from the comfort of their home or computer station and at a time that's convenient for them. And that includes a downloadable e-manual for the participants. AGE is also in the final stages now of developing a follow-up classroom session facilitated by a GPA certified coach called iGPA, or Integrated GPA, that represents a blended classroom model to accompany the e-learning program. Now, before we proceed any further into discussions about GPA, let's watch the video clip that was created to celebrate the launch of the 3rd edition in 2014. As mentioned earlier, the video clip is found on YouTube, and the link is included in your resources, the materials part of this webinar. And bear with me here, sorry.
You have to look at the holistic approach to this person. It's not just this person in room 622. It's this is such and such or Mr. such and such, and they used to be a wife, they used to be a mother, they used to be involved in their community. I really like green tea. Oh, good for you. This is Shirley McGill. She is a patient at St. Peter's Hospital. She's a very friendly, very enthusiastic, very social lady that we love to have in any of our programs that we offer through therapeutic recreation services.
This is Kim, who helps me with a lot of horticultural things and other activities. We've done a lot of bocce ball, bowling, social programs that I'm very thankful I have that I wouldn't have ordinarily, and surprising that I can do. Everyone's very kind and very helpful, and I think they have a lot of concern for us.
Gentle Persuasive Approaches has been a real act of love. There were a number of collaborators who were really interested in the fact that there was a tension between safety of staff and person-centered care. We created this particular
training education program to help staff feel more confident when they were caring for older adults with cognitive impairments like Alzheimer's disease. The Gentle Persuasive Approaches, or GPA, is a curricula that has been developed and evaluated and is really looking at providing that frontline healthcare worker with education and training on dementia care. There are 4 modules in the dementia curricula.
That first module, the person-centered care module, is the most important for staff to understand. They cannot look after somebody if they don't know who they are. So that's our impact. Boom, right away.
The second module includes brain and behavior and all of the various details with respect to how the brain is impacted by dementia, so that these behaviors that the individual resident displays are understood from a brain etiology perspective. Then the third module deals with communication strategies.
Communication is key, absolutely key. You've got to recognize that this person has brain damage, but you need to look at the way you're communicating with that person to be able to get a positive effect.
And the fourth module includes strategies that healthcare providers can use to reduce the likelihood of injury to themselves or to the resident patient.
We know that over the coming 2 decades, our older population is going to double in numbers, and we also know that the people living with dementia is expected to double as well. And that means that we're going to have more people living in our communities. We're going to be interacting with the health system who actually have dementia and also have responsive behaviors as well. What I'm particularly impressed with is that the GPA work, it's been researched that has shown that it can really improve the confidence of the staff who take these programs, that they can better manage situations that sometimes they might think is catastrophic, and now they realize they're actually highly manageable. We've also seen great evidence to show that this sort of work and this sort of training has actually helped to improve the actual care that's being received by older patients with dementia as well. It's really important that we have curriculums like these that can really empower frontline workers to have the knowledge, skills, and attitudes they need to provide the responsive care that older patients with dementia really deserve.
10 years in the process of developing GPA, and we're still going strong. It just blows my mind, really, on where we've come from and the vision of where we're going and the opportunities.
I've always been very passionate about this curricula, so I get goosebumps when I talk about it. I believe this curricula can really make a big change. We knew in our hearts that this was something that was innovative and novel that wasn't offered to anybody else. And we've been quite successful. Now that we're at 10 years, our goal is to spread the word and embed this curriculum in all the training programs for healthcare providers. And I think we'll make great inroads.
Person-centered care, I think it is a part of my being, it always has been, and that's why I'm in this field. I guess it's the most important thing to me in my role is to try to make a difference. No one knows what their time is, and I feel so grateful that they will let us into that time. They don't know me when they come in here. Sometimes they're only here for days, weeks, maybe months. And for them to let me into that part of their life and try and bring them joy or allow them to have joy back in their life, that's very fulfilling for me, to enable them to enjoy the rest of the life that they have.
It's teaching you how to be so compassionate too. I'm very grateful, very grateful.
Okay, so in the GPA curriculum, the overall goal for the learners is that they can come away to use a person-centered, compassionate, and gentle, persuasive approach to respond respectfully with confidence and skill to behaviors associated with dementia. So let's just start with a check-in. Melissa's going to post some poll questions for us. And I just want you to let us know from where you sit whether or not you have cared for someone living with dementia. Yes, no. And the second question is whether or not you know or have known someone living with dementia. So we'll give you a few minutes to look at that. And Melissa, I may need you to pop in when you close the poll to share the results.
Sure, we're just going to give a couple more seconds on the first poll question, and then we'll jump to the second one that you mentioned. Okay, so I think I'll close that one and share the results. Can you see the results of the first question on the screen?
I cannot.
Okay, so the first question, I have cared for someone living with dementia, and the results were a whopping 90% of the responders said yes, and 13% said no. And then we'll open the poll for the second question. And give everyone a few seconds there. I know or have known someone living with dementia. We'll just leave that open for about 30 seconds. Yeah. So that's pretty clear. Everyone said 100% said yes on that poll question.
Okay. Thank you very much for that, Melissa. And that is exactly as I expected, and that really leads us in, as mentioned in the video by Dr. Sinha, when he said that the population is aging. And we know with the population aging, the incidence of prevalence of dementia is also increasing. So persons living with dementia will be in need of care, and they will be in need of care from people who know how to care for people living with dementia, to know how to care for them as individuals. So this graph here is from the Rising Tide document produced by the Alzheimer's Society, probably familiar to many of you. It is from 2010, and it just clearly shows the need to understand how to address the healthcare needs of persons living with dementia. As the population ages, it is expected that these numbers will rise to close to 255,000 people in 2020. But by 2038, over 430,000 people are predicted to be living with some type of dementia. Okay, and as Patty mentioned, that brings on the importance of us equipping healthcare providers with safe, respectful practices to provide person-centered care. So let's do another check-in, and we may do it that way again, Melissa, with the poll. Based on your knowledge and understanding, these are true-false questions. Persons living with dementia can still express their wishes and needs. Is that true or false? And I assume Melissa might do them one at a time, but the second part of that is persons living with dementia can still contribute to their community, true or false?
So those two are grouped together and the votes are coming in strong, but again, it's looking like 100% are responding as true to both questions.
Excellent. Okay, great. So those are the answers we were seeking, and those are the answers certainly that participants of GPA would come away with, is to be equipped with this knowledge and understanding that people are unique human beings. And as mentioned in the video, the module 1, the first part of GPA, sets the tone for that. It introduces the concept of personhood and person-centered care with the goal of understanding that a person living with dementia is a unique human being, still very much capable of interacting with the outside world. in GPA Basics, this is accomplished through facilitated large and small group discussions, self-reflection, interactive exercises, video clips, whiteboard animations, and experiential activities. Cognitive and emotional learning is also applied in Module 1, and this is done through passages and videos that provide the learners with the experience of what it might be like to actually live with dementia. Discussion for the day begins with the participants sharing examples of situations during which a person with dementia responded to them. They responded with a behavior that they perceived as risky or frightening. Now, this sets the tone for the day. Learners then continue to apply their knowledge back to these stories throughout the session. What one learner left us with a quote is, what I learned from GPA is we can never lose sight of the dignity of the person with dementia. Okay, the next check-in. Persons living with dementia will experience challenges interpreting the world around them, true or false. And along with that is that persons with dementia become angry and violent because of their disease. Is that true or false?
Okay, so the first part of that question about experiencing challenges, interpreting the world around them, 100% of the respondents said true. And if we open the next one, we'll see what comes in. We'll just give everyone a few more seconds here to get their votes in for B. Okay, I'll just close it off there. And for the second part of that question, we had 77% responded true and 23% responded false about a person living with dementia becoming angry and violent because of their disease.
Thank you so much, Melissa. And I will be honest, some of these you might have thought, is this a trick question? And this is part of the reason we created Gentle Persuasive Approaches, is to help people understand, as we talk about in Module 2, brain and behavior, that while the disease process can impact the way the individual perceives the world around them, it's not inevitable that people with a condition that causes a dementia syndrome, so people with Alzheimer's disease or related dementia, it's not inevitable. They do not always necessarily respond in angry and physical ways. And we try to equip the care providers with the understanding of how to approach with the best practices to minimize the chance that a person will be responsive. And what we try to do too is GPA starts to reframe the behavior and reframe that language, moving from saying the words aggression and violence, as mentioned in the video and by Patty, to understanding the behaviors as their responsive attempt. They're responding to something in the environment, responding to what they perceive as a threat, or to try to protect, defend, or exert control over a situation where they feel they've lost control. So in Module 2, learners discuss how the cognitive and perceptual losses associated with dementia can impact their behavioral response, and thus the care implications for care providers. What we also do is we focus on the strategies that compensate for these losses and try to maximize the person's remaining strengths. And this also builds on Module 1, is that critical component of knowing the person and knowing their strengths. A key takeaway message is that the person's behavioral response is not intentional to cause you harm or make your day worse, that the person is responding to the best of their ability based on the information they have access to at the time. So while the dementia or the Alzheimer's disease can predispose them to a responsive behavior, ultimately we learn it's some sort of trigger, some sort of unmet need, something that is the immediate causative factor. And this is discussed throughout the whole day of GPA and applied to example situations. Learners also discuss ways to support the person's ability and help them be as successful as they can possibly be during any care interaction. So up here is a picture of the brain. We use images, an image like this, really to convey the message that sometimes we might not be able to see what's underlying the person's condition. We may expect a whole lot out of them that perhaps their abilities don't allow them to respond in the way that we would respond. They're going to respond in the way that their brain tells them they should respond in that situation. So this quote from a learner is critical. I learned that most behaviors are not intentional. This is where I always say it's not about you. And that's the key message we want people to come away with. Okay, check-in 4, let's say. What are your thoughts on this? Persons living with dementia, true or false? They provide us cues with about how, they provide us with cues about how they are feeling. And they respond to triggers in their environment, true or false. You can see how the learning is additive. I'll pass it to Melissa to manage the poll.
Yep, the votes are still pouring in. These two questions are grouped together. We'll just close it off there and share the results. We've got 100% of people responding as true, that persons living with dementia provide us with cues on how they are feeling and they respond to triggers in their environment.
Okay, excellent, excellent. So what we see here, this photo, and I'm imagining if I asked you, what do you think's going on with this gentleman, perhaps we could say a message he might be conveying through his body language and facial expression is potentially pain. You know, we speak of pain as a possible trigger, one of the causative factors or underlying contributing factors to a responsive behavior. So yes, 100%, absolutely. This is what we talk about throughout the day in GPA. How do we recognize that a person is uncomfortable, that they're becoming upset, that they're becoming distressed? And this is what we start to look at in Module 3, the interpersonal environment. And we respect that the care providers, we are the environment, we're part of the environment, and we can also be some of the main triggers to the responsive behaviors that we see. So we start to coach people and work with them on exploring ways that they can approach such that the person will not get as upset. So we apply emotional, environmental, and interpersonal communication strategies to prevent and diffuse responsive behaviors. We discuss and practice strategies to reduce the likelihood of a negative behavioral response. One of the key learnings in Module 3 is done through an experiential exercise. We get participants up and we get them on the floor, and maybe some of you who are listening in today have done this exercise, personal space. We get them up and we actually bring them to a point where they have to feel uncomfortable so that when we ask them to step back out of each other's personal space, they feel that immediate sense of relief when they step back from that person's space. We identify this as the stop and go, and we continue to build on that. That's what it looks like to stop and to provide yourself and another human being with a sense of control over what's going on to their bodies, to their space, to their person. We also introduced the behavioral escalation scale, as Patty identified earlier in the slide, earlier in the presentation, with the behavioral escalation prevention plan. What this is, it's a pattern of behavioral changes that indicate distress, and we introduce that to participants and discuss when should you step back to minimize the risk in a situation. And ideally, the teaching and the learning is that as soon as you notice the most subtle changes that this person is uncomfortable in the situation, that is when you should step back to minimize the chance of a responsive behavior. And we do this and we demonstrate it through the use of a video, which is a real life scenario of a care provider who has the best of intentions to get care done on a gentleman, and her sense is she has to get it done. And we ask care providers to count the number of times that this gentleman sends her a message that he needs her to stop. And the learners do this. And in fact, one of the messages the gentleman sends is raising his fist with a threatening stance as if to hit her, but he doesn't hit her. And the discussion ensues that that was actually about the 10th message he sent her, that if we are able to step back, observe, pay attention with all of our senses, that individuals are sending us messages that they're uncomfortable and they need us to stop, and learners are encouraged to stop and given permission to do so. We also talk about some actual strategies such as validation, to acknowledge the person in whatever time or place is real to them, avoid arguing and avoid challenging, and using validation as a part of what's called successful verbal redirection. And that helps the learners have strategies to approach and reapproach. You'll actually get a chance to try this out at the end of the presentation. So here's the quote you've probably already read now. I know now to join their world when they are distressed so I can better understand and better help them. Okay, check-in 5. Persons living with dementia often show subtle signs that they are distressed. True or false? And persons living with dementia require immediate physical redirection when they are upset.
Okay, so the first one, we still have responses coming in, but I'll just give everyone another second. Take it up to 75. Okay. So for the first question, 90% of respondents said true. People living with dementia often show subtle signs that they are distressed, and 10% responded as false. Now I'll launch the next poll. Give everyone a few seconds there. Okay, and when we look at that one, I know people were still logging in their votes, but 72% responded false in this case, that persons living with dementia require immediate physical redirection when they are upset.
Okay, excellent. Thank you so much, Melissa. And for the 90% who said that persons living with dementia do often show subtle signs that they are distressed, and for the 10% may have known of or worked with individuals who are part of that, less than 2% of all persons with dementia may react with spontaneous, unprovoked, but for the most part, one of the messages we try to convey to people is that for the most part, persons with dementia will show us very subtle signs, and it's up to us to sort of recognize them and step back. As far as the immediate physical redirection when people are upset, that is also good. 72% say false, because this is one of the challenges that healthcare staff face is in a situation they feel they have to do something right away. They have to fix it. They have to stop it. And in GPA, we explore it. We teach them the principles in Module 4 of the suitable and respectful physical techniques to use in situations of risk. And while in Module 4 we do teach those techniques, learners are also reminded that hands-on is absolutely used as a last resort. Other concepts that are discussed in Module 4 include what we call doing nothing is having a plan. And certified coaches draw upon strategies that from Modules 1, 2 and 3, to remind learners that stepping back, supporting the person to express themselves, using validation and minimizing the risk of the situation is also very critical to de-escalation. It's about choosing carefully and assessing the risk in the situation, determining whether or not you need to put hands on. At the end of the day, if there would have been, once the learners do practice the physical techniques together to, respond to, strikes, kicks, or grabs, and then also gentle redirection techniques to remove someone from a situation of risk. If there have been what ifs throughout the day or case scenarios that they've drawn to mind about people in their care setting, then they have a chance at the end of the day to do applied practice, or otherwise known as role play. And it allows the participants to apply all their learning from the session to situations from their own care. And that integrates their new knowledge and skills. And it helps them engage in solution finding in the moment as a team. So the actual day of GPA can serve as a way for the teams to determine how GPA strategies can help them care for the persons that are currently in their care setting in a safe way. So again, to reiterate from this GPA participant from St. Peter's Hospital, said that I learned that hands-on should be the very last resort. So these are just some of the concepts that are included. This by no means, this is an hour webinar in GPA Basics. It's a full day facilitated by coaches, and the e-learning is a 2.5 to 3 hour online session. Just to summarize, this is actually taken from Module 1. We include the Dementia Bill of Rights from Virginia Bell and David Troxell. They've included this in their Best Friends Approach to Dementia Care. But some of the basic rights are that persons living with dementia have a right to be with individuals who know their life story. They have a right to experience meaningful engagement throughout the day. And they have a right to have care partners well trained in dementia care, and to be free of psychotropic medications wherever possible. So again, just a few of the rights that we discussed early on in Module 1 and try to carry the themes throughout the day. All right, let's just try one of the things out. Although we didn't really cover the content, just a basic scenario that's probably pretty familiar to people. A woman in your care setting keeps waiting for her husband to come home from work, and you are aware the husband has died. So the best way for you to respond is by saying, and we'll give you 4 choices here. Your husband isn't coming home. Don't you remember? He is dead. Let's wait in the dining room. It's time for dinner. Your husband is probably working late. You're waiting for your husband? I see this is important to you. I'm waiting for someone too. May I join you? Tell me about your husband. So I'll let Melissa pull that up as a poll.
We'll give everyone a few more seconds, but it's pretty clear that most people are leaning towards the option number D. Yes, 100% of the respondents chose the last option.
That's fantastic. So that could either be because you've all taken GPA and you're very familiar with successful verbal redirection, or it could be that it was the last one, the longest one. So the principle is successful verbal redirection, and you get to try that out in GPA. So it's validating the person and joining them one way or another. One of the things I tried to convey there is my calm and supportive, caring tone of voice. People who use A, B, or C often have they're well-meaning. They're not malintentioned. They just don't know what to say or how to respond. So GPA really helps participants understand a framework or principles that they can apply to any situation. So that was just one little test for us. the goal is we really want to avoid challenging or confronting the person's errors. So why this is important too is because GPA, it promotes a team approach. It reinforces a consistent response. So let's hypothetically say in the previous scenario, if half the staff is saying, no, you have to tell her he's not coming, or the other half says he's coming home late from work. It's even more confusing for the person. So using a unified team approach is good for staff, good for response and staff morale. Few quotes about what people say about GPA. This from Robin Stainton, who's a GPA certified coach at the Alzheimer's Society of Peel. Just today, I had a staff member approach me on our lunch to share excitedly that in the past week, she tried the GPA doing nothing is having a plan strategy, and it really works. This staff member completed GPA Basics a number of years ago, but recently attended the GPA Recharge. Jill Corkery, who's a PSW instructor and GPA certified coach, says, families often comment on how the students treat their loved ones with such dignity. I've had students contact me after graduating to tell me with great pride how their GPA training made a difference for someone in their care. And we do get powerful testimonials from students. Monica Barindi, a GPA certified coach at Parkview Home, says, we started training staff in person-centered care in GPA. We noticed a decrease in the number of falls. We eliminated restraints within the home, and we saw a great increase in the number of residents participating in meaningful activities. So very good outcomes for the staff there at Parkview Homes. And I invite you to check out the research hub of our website where you can read other research articles as well. And Lisa Walkapie, who is a GPA certified master coach and director of senior care at Book Jane, says, as part of our recruitment process at Book Jane, we seek candidates that have had their GPA certificate, and we know that these individuals have the knowledge, skills, and ability to provide extraordinary care to persons living with dementia. It certainly is key criteria in our hiring process. And as Patty mentioned, I do encourage you to read the leadership, the AGE GPA Leadership Recognition Awards on the website as well, because very powerful testimonials and great examples of how organizations implemented and sustained GPA. For those who are Francophone or serve Francophone communities, we have translated the GPA program with the support of the Réseau Franco-Santé du Sud in Ontario. I apologize for my French pronunciation. It is known as the ADP, Approaches douces et persuasives. And we are currently also recruiting Francophone GPA master coaches to help implement the French product further. Those are just some of the references that I referred to within the content that's from the GPA content. I will leave it at this slide. AGE is at www.ageinc.ca. Please follow us on Facebook, the Twitter, and LinkedIn. And I will pass it to Melissa to facilitate any questions you may have. Thank you very much for your attention.
Hi there, Michelle. I just see one question that's popped up in the chat box a little earlier. And someone would like to know if the e-learning modules are free of charge and how do people access the e-learning?
It's Patty here. No, the GPA e-learning is not free of charge. We have to charge, as I said, we're not for profit, we're not funded, and we have to pay our learning platform provider for maintenance and for technical support. So it is available by going onto our web. What we have done for organizations is we have significant discounts in volume pricing. So individually, it is $90. It's a 4-module course, takes roughly 2 to 3 hours. But there's significant discounts. You'll see that on our webpage for volume discount to offer organizations if they want to train all their staff. There is significant savings.
Thank you for that, Patty. Now, anyone else would like to share a question at this time? Feel free to unmute your own line, or you can type away on the chat box and I'll read your question out loud. Everyone's quiet today. It must be the heat.
Well, we have lots of information on our website, and there's info@AGE. There's an opportunity to submit questions through the website, and we'll channel them to the right person here at the team of AGE.
I actually had a question myself. This is Melissa speaking again. I was just wondering how often you recommend that teams go through the recharge or the refresher version of the GPA program.
Oh, so that's a really good question, Melissa. And the recommended renewal cycle is that following initial exposure to GPA, either through the GPA Basics full day or e-learning program, we recommend that within a year and yearly for 2 to 3 years, do the GPA R. The GPA R is GPA Recharged. It's a 2-hour session or done as 2 1-hour sessions. And that is an opportunity for an in-house coach to take teams through practical application as it relates to the care situations in their own organization. And it relies on using the activities learning package, which is one of the modalities that coaches have access to for conveying the content and sort of encouraging discussion. More recently, we have accepted informal coaching for maintenance hours of coaches. So coaches are certified and have to maintain their certification by completing and logging 40 hours over 2 years. But within that 40 hours, we do accept informal coaching, which is case-based consultation, behavioral team huddles, facilitating responsive behavior teams, because we want them to keep the GPA language, content, knowledge, skills alive every day and not wait till, you know, a GPAR a year later. It's sort of getting it into practice on a regular basis. And that's where the recognition awards that are profiled on our website have some really great ideas about how coaches have done this and how organizations have supported it.
Thank you very much. I see one more question in the chat about whether this presentation today will be available on the website, and I can answer that yes, today's webinar is being recorded and it will be archived on the OARC website. And if you'd like to access the slide deck of today's presentation, it is available in the materials section of the platform that we're using today. So in your toolbar for the program, if there's something that says materials, and the slide deck is there, as well as the video we watched and the shifting focus booklet. Now, from a residence council perspective, I'm just wondering how the resident council might be able to champion or support the GPA program in the long-term care homes. Michelle and Patty, do you have any maybe advice on that?
It's Patty here, and I would recommend that there's some questions asked at the in the retirement community about whether the retirement home specifically has trained their staff in GPA, and they could advocate for training in GPA.
Yeah, I think that's a great idea. Residence councils often do a lot of fundraising as well, so they might even take up the cause of helping to offset the costs of paying for the annual recharge, because it really would benefit the well-being and quality of life for residents as well as team members.
That's right. Excellent idea. And I mentioned retirement homes, but it's also long-term care. So, you know, wherever these councils are, you know, they could be recommending that the organization ensure they're not only training their staff in GPA, but also that they're engaging in the annual refreshers.
That's great. Thank you so much. We've
And
had some positive feedback in the chat also about the interactive nature of our presentation today. So thank you so much. And as I don't see any other questions popping up, I'll take this opportunity to say thank you so much to both Patty and Michelle for putting together such an interactive and informative presentation today. Thank you on behalf of OARC as well as the participants on the call today. It's really been a great afternoon. So thank you.
Great. Thanks for having us.
Thank you so much, and thanks for all you do.